Hello and welcome to this episode of Deep Dive by NewsX. I'm Uday Pratap Singh. In the hallowed halls of hospitals, they are considered living gods. Their white coats a beacon of hope in the darkest of times. We've all been there, standing anxious in hospital corridors, hoping to hear that our loved ones are recovering well. Now imagine this. You rush to the hospital because your loved one complains of chest pain. You're terrified, expecting urgent care, but instead you're met with a clock. You're forced to wait 8 hours, only to be told the pain isn't real enough. You're gaslit, dismissed and told it's just an acute problem while you watch them suffer right in front of you. What I just described isn't a hypothetical scenario. It's not a what if. This is the kind of torture 44-year-old Prashant Sreekumar had to face at Grey Nuns Community Hospital in Edmonton, Alberta in Canada. Before he passed away from a cardiac arrest, they had shrugged off as nothing serious. In a moment of unimaginable pain, Niharika Sreekumar stood next to her husband's body and recounted their 8-hour nightmare. Listen in.
By 12:15, 12:20, he was sitting in the triage from 12:20 onward till about, I would say, 8:50 on till about 8:50 in the night. He was sitting in the triage, complaining of constant chest pain. His BP constantly kept on rising with the last recorded blood pressure of 210. He was taken inside. He was only prescribed Tylenol during the entire waiting time that he was outside. And he was not given help. They said that chest pain is not considered acute problem. They do not suspect a cardiac arrest. When he came inside, he was asked to sit down. He got up for fraction of second and he collapsed. He fainted and the nurse was heard saying that I do not feel a pulse. So basically, the hospital administration, the employees of Grey Nuns Hospital have basically killed my husband Prashant Sreekumar by not providing him timely medical help. And the security was so rude that instead of addressing the cause, they said, ma'am, you are being very rude. So basically, it is okay for them to kill a human being and to tell the wife that you are being rude. Thank you. This is my statement and I would want this to be taken to the court.
Prashant's father was there through every agonizing minute. He had to listen as his son turned to him and said, Papa, I cannot bear the pain. He watched as Prashant pleaded with the nurses, telling them, my pain feels like a 15 out of 10. His father was forced to sit there, a witness to his own son, yelping for help, completely at the mercy of a hospital that wouldn't listen. Prashant leaves behind his wife and 3 children, just 3, 10 and 14 years old. They lost the man who loved to take them on adventures, the father they described as a goofball, who was always at the center of their world. Prashant Sreekumar was more than just a patient in a waiting room. He was a husband, a father of 3, a son and a friend who was answerable for his murder. Who will take accountability for the hole left in the lives of everyone who loved him? The responsibility lies with one place, the Grey Nuns Community Hospital. They take great pride in their history, boasting that they have been serving the people of Southeast Edmonton since 1998. Across 19 different sites. They talk about their scale, their reach and their legacy. But look at their mission statement. Their website tells us, and I quote, as part of Covenant, we are called to serve people from birth to end of life with compassion. They promise to deliver holistic care that uplifts the body, mind and soul. They proudly tout that everything they do is at the heart and laud their excellence, claiming that this is exactly how they deliver their best. But these are mere claims. Where was the heart during those 8 hours Prashant Sreekumar had to suffer? Where was the excellence when a father was pleading for his life? Is apathy really a best a hospital can offer to a patient who had been complaining of chest pain for hours on end? As the family tries to remember Prashant for all the good he brought to them, they say that they will always be haunted by how he died in pain, in hospital without ever seeing a doctor. How will this family get justice? Well, joining us now live is Dr. P.S.V. Rao, Consultant Surgeon, Manipal Hospital, Hebal, Bengaluru. Dr. Rao, what do you make of this ordeal that this family had to suffer in Canada?
Good evening, Uday, and to all your viewers. This is horrific. No, nothing can excuse this kind of total negligence of the problem. I'll give you this severe pain occurs when blood supply is cut off to some part of the body, or when there is cancer infiltrating nerves. These are the kinds of pain which are extremely severe. Now, if this man was having such severe chest pain, obviously his heart's blood supply was getting blocked. And this needed immediate treatment Forget 8 hours. Even 8 minutes can be crucial in this kind of stages. And we talk about the golden 1 hour from some of these cases where 8 hours. My God, I can't believe this. And I'll tell you a recent incident in which at 6 in the morning, a vice chancellor of a university here in Bangalore rang me up saying that I am having not severe chest pain. He was having some discomfort between his chest and his stomach. And he said, either I'm having some chest congestion or I'm having some kind of a gastric. This is at 6 a.m. on 6 a.m. in the morning. I said, nothing doing. You immediately rush to the hospital. And I asked the hospital emergency doctor to do a ECG, a echo, and enzymes, that is the troponin enzymes. And soon the doctor rang back saying that the ECG is showing only mild changes. It's not very significant. And the echo is normal. And then I said, the enzymes, it's coming in a few minutes. The enzymes came, it came 3000. I immediately rang up the cardiologist, and the cardiologist said, my duty is ending. I am leaving for the airport. Can you kindly speak to the other cardiologist? So I rang up the other cardiologist, dragged him from home. We did an immediate cath, and the cath, and it was a horrific, extensive blockage of a artery, of the heart, coronary artery that we call it. And then he had to put not one stent, he had to finally land up putting 4 stents, but finally his life was saved. And not only his life was saved, there has been no heart damage. And finally this man has been dragged from home. The cardiologist didn't have his breakfast, didn't care about anything, got the job done. That's how we saved him. Now you are trying to tell me that in Canada they take 8 hours and they do nothing about it? My God, I can't believe it. This is totally inexcusable. This death is on their hands, for sure. This is totally inexcusable. Here, see, this patient here didn't have chest pain. He was just complaining of some discomfort between the chest and the stomach. There it is such severe pain, it is very obvious. And obviously, neither their cardiologist was either was not informed, or they just didn't bother to come. They took life easy. How can you ignore someone with such severe chest pain? Obviously, there is, it means that there was severe myocardial infarction, ischemia going on. Ischemia means decreased blood supply, which will eventually lead to infarction. And if it is a massive infarction, the person will be dead.
Should this then be seen as an aberration, or is this how healthcare has really become there in Canada, unfortunately?
No, absolutely not acceptable. And I have had patients coming from Canada all the way to Bangalore because of waiting lists. But those are for elective surgeries. If there is going to be such waiting for emergency like this, then that means there is no emergency care there. And this is the commonest thing, real emergency that we have other than accidents, other than traffic accidents or someone being shot or someone being knifed. This is the real emergency. Either a heart attack or a stroke. In a stroke, of course, the brain gives you no more than 7 minutes. The heart gives you a slightly longer period of time. But these are two vital organs. If the blood supply to the brain is stopped, or the blood supply to the heart muscles is stopped, that's the end of the life. Then you can't do a thing. Once the person is dead, it is dead. How will you get it back? This is totally unacceptable, Uday. There is no way any hospital anywhere can accept it. That too, if you have the facilities for cardiologists and cardiac care. And if they didn't have it, they should have immediately put him in an ambulance with the doctor taking care of him and rushed him to a hospital which had the facilities. It is not that every hospital has a facility for cardiac catheterization and all that. But you can't just leave the person dying like this in severe pain. This is totally unacceptable, Uday.
Absolutely, completely, of course, unacceptable. And this person could have been saved. That is the sad part, isn't it, Dr. Rao? This person could have been saved.
You had enough time. 8 hours you had to save him. You just needed a few minutes to save him. And if the ECG was not this thing, you also have to do the troponin enzymes. Those things are available. It was not available in the past. I have been a surgeon for 48 years. Uday, when I began, we only had ECG. And we didn't have echo, there was no ultrasound, we didn't have troponin enzymes. All these facilities are available nowadays. You can do cath, you can do a coronary angio, and you can put a stent. None of these facilities were available in those days. Now when all these facilities are available, if you can't do it, what the hell is this? This is totally unacceptable. And this is why I gave you the example of how we saved that vice chancellor. That was just 2-3 weeks back. It was not some long time back. And at 10:30 later in the morning, when I asked the cardiologist, at least have you had breakfast? He said, no, where breakfast? You dragged me out for this case, and after that there are so many other cases, I have not had breakfast. That is the dedication of a doctor here, a cardiologist here. And what is going on in Canada? Do they have the facility, or they had the facility and still neglected the patient? And if they didn't have, they should have immediately put this patient on a ambulance and sent him to the nearest place where there is facility. And don't tell me in Canada they don't have facility, and this seems to be a major city in Canada. I couldn't clearly hear what you said, but I am sure this is they would have had, and if necessary, even flown the person.
Dr. Rao, thank you for joining us with your perspective on this segment.